Joining us now is Dr. Francois Picot with CMC Northeast and the Northeast Neurology Group in Concord, and also has offices in Brookdale.
Thanks for coming on the show, Francois.
Thank you for having me.
Now, stroke's been in the news a lot lately about how to prevent one or how to recognize a stroke victim. So what exactly is a stroke?
A stroke is when you have an interruption of blood flow to a certain part of the brain, and if it occurs for too long, you can have permanent deficits, giving rise to either paralysis on one side, numbness, or unsteady gait with speech disturbances.
And how does somebody know if they're showing symptoms of a stroke?
Well, they can have a sudden onset of a speech disturbance. They can be weak on one side, suddenly not be able to walk, unsteady, confusion, severe headache. Those are usually symptoms of acute.
You know, I was reading too that they were saying that some people will go on days without realizing that they're having a stroke or that they've had one. So is there a guideline you can use to see if someone's really truly having a stroke? Are there any tests you can do yourself at home?
Well, there's a system, it's called FAST, F-A-S-T. You look at the person's face to see whether there's any asymmetry in the face. Then you look at the arm and see whether they have a drift. You put the arms up and they start drifting, or if they feel weak on one side. The other is speech, which if they have a hard time getting their words out, or there's a disturbance in the speech. And then the last thing you do is call 911. If someone has any of these symptoms, you want to call 911 and get them to the emergency room as quickly as possible.
So how much time do you have? You know, I know there's that critical window.
Right. They just changed. It used to be a 3-hour window, and now it's a 4.5-hour window. So at the onset of the symptoms, you want to get the patient as quickly as possible to the emergency room. They have 4.5 hours to give a drug, IV drug called TPA, which is like a clot buster. And if the patient is evaluated quickly by a neurologist or an ER physician, you can give the TPA on time to try to help bust up the clot.
Does it matter when you call 911? Should you tell them which hospital do you want to go to, or are there certain hospitals that are better equipped than others?
When you call 911, you need to let the operator know that the patient is having stroke symptoms, and the EMT people are aware of how to deal and triage these patients, and they bring them to the appropriate hospital where they have a stroke center.
Now, are there some in the area that are set up for that?
Well, the CMC Maine, there's a CMC Northeast. There's also the Presbyterian Hospital. It depends on how close they are to the hospital, and if they go to another hospital and they don't have the appropriate facility to treat a stroke, an acute stroke, then they usually transfer very quickly to another hospital.
Mm-hmm. So the majority of strokes are caused by, you said, what, blood clots?
Blood clot. About 85 to 90% of strokes usually are what's called ischemic strokes, where you basically have a blockage of a blood vessel called an artery to the brain, and you get a deficit. The other types of strokes are hemorrhage. You don't really know what type of stroke somebody has until you bring them to the hospital where they have to be evaluated. When they get to the emergency room, they go for a CAT scan almost right away. You can tell almost right away whether someone has a bleed or an ischemic stroke. Ischemic strokes are caused by a number of things. They're caused by plaques developing in the major arteries that can sometimes get occluded. They can be caused by clots in the heart that dislodge and go into the circulation of the brain. They're the type of stroke that we treat with TPA if the patient comes in on time. The hemorrhagic strokes is a different type of stroke because it's a rupture of an artery, and there's a bleed inside the brain. So you don't want to treat patients with TPA with that, because TPA can cause bleeding. So the patients who have bleeds don't get TPA at all.
What's the difference between an aneurysm and a stroke?
An aneurysm is a ballooning of a small artery inside the brain, and if it balloons up and to the point where sometimes it ruptures. And when it ruptures, it can call it subarachnoid hemorrhage, which is different than a hypertensive intracranial hemorrhage. But with patients with aneurysmal bleeds, don't get TPA either. You can have stroke symptoms with that, but you have a severe headache usually, and stroke symptoms, but you don't get TPA because of the bleed.
So what are the statistics? How do strokes compare to, say, cancer or heart attacks? Is it?
Strokes are the third leading cause of death in this country. Number one is heart attacks. Number two is cancer.
Okay.
Strokes affect about 600,000 people a year. That's given or taken depending on the year. There are about 160 people who die from stroke, and then about half people who have strokes usually have very significant disabilities.
And then is it hereditary, or are there things that people can do health-wise to help prevent a stroke?
very little is known about the hereditary part of stroke. There are a lot of preventive measures. There are some that the things you cannot prevent. They're called non-modifiable risk. Age, there's nothing you can do about age, but the strong risk factors. You get older, you have a high risk for stroke. Gender, usually a little bit higher in men than women, 1.3 to 1 ratio, and it's more common in African Americans than it is in whites, for example. So race does kind of play a role in terms of higher risk in stroke. The modifiable risk factors include high blood pressure, which you can control, cholesterol, diabetes, smoking, obesity, lack of exercise, and sometimes carotid disease like arteries that have plaques. Sometimes you can fix them before they cause strokes.
So it's mostly the same kinds of health preventative things that you would want to do for heart attacks and other types of...
Absolutely.
Now, if you have a stroke, are you more prone to having another one?
You do have a risk, but if you have very strong risk factors and you for example, if you never took aspirin before you had a stroke and you have an identifiable risk and you find a reason for someone to have a stroke, if you treat that, usually the risks do become more minimal. Mm-hmm. If you don't follow the doctor's recommendations, you have a high risk of having a stroke. But no matter what you do, you're right, you still have a high risk of having a stroke after having had one stroke.
Okay. Well, thank you for coming on the show. Is there anything else you'd like to tell the viewers about strokes? Did we miss something?
If you do have stroke-like symptoms, you need to call 911 right away, and no matter what, and wait a few days and get treated right away before the stroke.
And again, it's face, arms,
arm,
speech,
and then 911.
Time to call.
Okay.
Thank you so much, Francois.
Thanks, Francois.
You're welcome.
We appreciate
Thank
it.
you.
On the